One of the challenges that healthcare digitalization has is that healthcare systems or institutions that have been digitalized for a long time are now facing the issue of dealing with legacy systems that are very difficult to either get rid of or renew in a little bit. So how are you kind of ensuring that long-term sustainability of digital systems that you're deploying now?
We do have a number of legacy systems, and this is what I was trying to indicate earlier. The legacy systems are actually costing us more than they're worth in terms of keeping around and providing active platforms. And so we are rapidly trying to get rid of these legacy systems, and hopefully we will over the next 2 years as we introduce our next generation system.
And how exactly are you doing that if it's not a secret? The reason I'm asking is that one of the strengths of the legacy systems is that the data lock in, the vendor lock in. So when you have a challenge that you're not quite sure how to migrate the data to perhaps a better new system, that's where old systems are still left in place. So just, how are you, what's the strategy to contain the already existing data that's been captured with the existing systems?
Well, I mean, the legacy systems we have are actually quite old. But having said that, much of our archive of medical information is in a format that we can easily transfer over to a new system. And we're not going to be held hostage by previous vendors in terms of having our data locked into their system. It's the way we organized things many years ago, and I think now we can take advantage of the fact that much of our data was archived in a way that would be, I wouldn't say easily transferable, but certainly transferable into the new generation of software.
So the strategic thinking was there already years ago?
It was, yeah.
And what is the state in this regard in Canada, if you look at it, from outside of where you work? Do you think... Yeah.
No, it's different in every province, and it's probably different within every institution within every province. It was just not something that was well conceived of